Welcome to This Explainer. I am so incredibly excited to dive into this with you today. Let me ask you something right out of the gate. Do you think living to a vibrant, healthy 100 years old is all about winning the genetic lottery? You know, the idea that you either got the good genes or you just didn't? Well, prepare to have that completely flipped upside down. Today, we're unpacking the actual blueprint for longevity. And as you're going to see, the secret to a long, healthy life, it's actually way closer to our daily habits and our immediate surroundings than it is to our DNA. Here's our roadmap for today. 1. The genetic lottery myth. 2. Lessons from the blue zones. 3. Pillars of healthy aging. 4. The gut microbiome connection. And 5. Engineering a longer life.
Section 1. The genetic lottery myth.
Okay, so to really understand what determines a long life, we've got to look at the famous Danish twin study. Scientists basically looked at thousands of twins to figure out exactly how much of our lifespan is just baked in, pre-programmed by the genetics we inherit. And here is the magic number they found, 20%. That's it. Only about 20% of how long the average person lives is actually dictated by our genes. Just 1/5 of the equation is written into your genetic code at birth.
But hey, the flip side of that stat, it's honestly incredibly empowering. A massive 80% of our lifespan is dictated by our lifestyle and our environment. This means the vast majority of your longevity is literally right in your hands and in the environment you build around yourself. You don't need a perfect genetic pedigree to make it into your early 90s, feeling great and largely free of chronic disease.
Section 2. Lessons from the blue zones.
So if 80% of it is lifestyle, what exactly should that lifestyle look like? Well, back in 2004, Dan Buettner teamed up with National Geographic and the National Institute on Aging to figure that out. Using epidemiological data and birth certificates, they physically tracked down the longest living communities on Earth. And they found these 5 demographically confirmed blue zones. We've got Loma Linda in California, Nicoya in Costa Rica, Sardinia in Italy, Ikaria in Greece, and Okinawa in Japan. In these exact hotspots, people are hitting 100 years old at 10 times the rate we see in the United States. No way, right?
Okay, so let's really dive into this. What on earth do a shepherd in Italy and a gardener in Japan actually have in common? Buettner's team distilled all the habits from these incredibly diverse regions into evidence-based common denominators. They call them the Power 9. Ready? We've got moving naturally, so just living an active life instead of pumping iron at a gym. Then there's having a clear purpose, taking time to downshift and actually shed stress, eating until you're just 80% full, leaning heavily into a plant-based diet, enjoying moderate wine at 5 p.m. with friends, sign me up for that one, belonging to a faith-based community, putting your loved ones first, and finally surrounding yourself with the right tribe or social circle.
Let's zoom in on a couple of these, starting with purpose. In Okinawa, they call this ikigai. In Nicoya, it's plan de vida. Essentially, it just means knowing exactly why you wake up in the morning. And this is a brilliant illustration of the mind-body connection, because researchers found that having a clear sense of purpose is actually worth up to 7 years of extra life expectancy. Just think about that for a second. 7 years. What is your ikigai? Then there's the 80% rule. This is perfectly captured by a 2,500-year-old Okinawan Confucian mantra, Hara Hachi Bu. They actually say this out loud before meals to remind themselves to stop eating when their stomachs are 80% full. The absolute crucial takeaway here is that this 20% gap, that space between not being hungry anymore and feeling Thanksgiving-level stuffed, that gap could literally be the difference between losing weight or gaining it over an entire lifetime.
And the power of adopting this kind of lifestyle? It's truly profound. Take the story of Stamatis Mouraitis. He moved to the U.S., chased the American dream, but unfortunately, at age 66, he was diagnosed with terminal lung cancer. But instead of staying in the States for treatment, he moved back to the blue zone of Ikaria, Greece, just to live out his final days with his parents. He started breathing the fresh air, eating the local Mediterranean diet, drinking the wine, and he even planted a garden he honestly never thought he'd live to see harvested. Well, 37 years later, he was still alive, tending a vineyard. When someone asked him what his secret was, he just smiled and said, "I just forgot to die."
Section 3. Pillars of healthy aging. Now that story is an absolutely incredible anthropological case study, right? But let's pivot from qualitative stories over to rigorous, quantitative clinical data. A brand new 2025 systematic review just dropped. They analyzed 35 randomized controlled trials with nearly 25,000 participants to see exactly how lifestyle impacts aging. And guess what? The hard data backs up the blue zones perfectly. Look at these risk reductions. Following a Mediterranean diet, That resulted in a 22% reduction in cardiovascular risk. Interventions focusing on social connections and community engagement dropped depression risk by a massive 30%. And preventative healthcare, like just getting routine checkups, slashed the prevalence of undiagnosed chronic conditions by 40%. The science is crystal clear here. These multi-dimensional lifestyle habits actively put the brakes on age-related decline.
To bring those clinical percentages back down to reality, let's look at Loma Linda, California, which is the only blue zone right here in the United States. It's an Adventist community, so people there eat a largely vegan, plant-based diet and strictly downshift for the Sabbath. Take Dr. Ellsworth Warham. At 95 years old, the contractor tried to charge him $6,000 to build a fence. He said no way and spent 3 days building the whole thing himself. Now, he did end up in the hospital later that month, but not as a patient. He was the surgeon performing one of his 20 open-heart surgeries that month, literally at 95 years old.
Section 4. The Gut Microbiome Connection.
I mean, incredible, right? Okay, now let's shift our focus entirely inward, right down to the microscopic level. Why exactly does a plant-rich, Mediterranean-style diet work so incredibly well? Well, there's an EU-sponsored project called NU-AGE, coordinated by immunologist Professor Claudio Franceschi, and they've been looking into how our diet physically alters the bacteria living in our guts. This research highlights a really fascinating, kind of scary concept called inflammaging. Basically, this is chronic, low-grade inflammation that researchers believe is a huge culprit behind age-related diseases. They found that diets high in fat and low in fiber are super common in the frailest older populations. But by adopting a Mediterranean diet, think lots of fiber, olive oil, and fruit, we're actually feeding the right kind of gut microbes. And those little guys help reduce the systemic inflammation, acting as a direct shield against physical and mental decline.
Section 5. Engineering a longer life.
All right, here is the real macro-level twist of this whole explainer. We know what to eat, we know how to move, and we know we need social ties. But in our modern world, putting the entire burden on individual willpower, it just totally fails. Within just 7 months, over 90% of people give up on their diets. So the real secret here is environmental design, which brings us to the life radius. Research shows we spend about 90% of our entire lives within just 5 miles of our home. So if we actually want to live longer, we have to engineer this 5-mile radius so that the healthy choice just becomes the easy, mindless choice. Think about it. If you've got 6 fast food places within a half-mile of your house, you are 40% more likely to be obese. Our environment literally dictates our health.
So how do we actually change this at a policy level? The European Union's Eat Well project looked into public interventions to improve nutrition, and they found that just handing people information, it's simply not enough. On one hand, you have countries like France and Hungary implementing interventionist measures, things like fat taxes on high-sugar foods and sugary drinks to try and curb consumption. On the flip side, the project noted the United States uses a totally different yet highly effective approach, subsidizing healthy foods for lower-income populations, specifically young mothers and children. Both of these are prime examples of environmental policy shifts aimed at changing what ultimately ends up on our dinner plates.
And we can actually see this kind of environmental engineering work miracles at the local community level too. The Blue Zones team went to Albert Lea, Minnesota, and implemented a community-wide blueprint. They didn't just tell everyone to go run on treadmills. No, they built walking paths around the local lake. They connected the city's sidewalks. They worked directly with grocery stores to swap out all that candy in the checkout lines for fruit and water. They even helped local schools ditch junk food fundraisers. And the result of all these little tweaks? After just a year and a half, the town saw a 3.2-year bump in life expectancy and a massive 40% drop in healthcare costs. By simply making the active, healthy option the unavoidable option, the entire community absolutely thrived. And that brings us to the end of our explainer today. As we've seen, 80% of your longevity is squarely in your hands and in the environment you shape around you. You don't necessarily need an expensive gym membership, and you definitely don't need perfect genes. What you need is purpose, connection, a whole lot of plants, and a community built for movement. So I want to leave you with this thought to chew on. Look around your home, your neighborhood, your 5-mile bubble. How will you shape your own life radius?